Now we're going to talk about the female cycle, specifically what's happening in the ovary versus what's happening in the uterus. So first, let's talk about what is the female cycle. And when we're talking about the female cycle, we're usually talking about a 28-day cycle. There is a norm of a 28-day cycle. And day one of the cycle is the day that the period starts. And according to a 28-day cycle, the period starts on day one and ends on day 5. And ovulation occurs on day 14. So days 1 through 14 are pre-ovulation days. And then after day 14, days 15 through 28 are post-ovulation days. Now, according to men, give or take a few days, this is what normal cycles look like. However, that's not exactly true because a normal woman's cycle can be anywhere between 18 to 21 days short or 35 days long. So as you can see, there's huge variation. And the number of days that she's having her bleeding can be as short as 2 days or as long as 7 or 8 days. So the only people who have 28-day cycles every single month are the ladies who are taking 28-day pill packs. However, we are going to do everything based on a 28-day cycle so that we have a norm from which we can deal with. So on the ovarian cycle, looking at a 28-day cycle, remember day 1 is the start of bleeding. So at day 1, even though the uterus is breaking down and bleeding, what is happening in the ovary is we have the effects of follicle stimulating hormones stimulating follicles to start growing. So we're increasing the number of follicular cells. So our estrogen levels are going up. Our follicles are getting larger and larger. So this part of the ovarian cycle is called the follicular phase, and this will continue until ovulation on day 14. Now, remember what triggered ovulation on day 14 was the LH surge, and what caused the LH surge was there was a massive level. You reached the critical point of estrogen being produced by those follicular cells. All right. After ovulation, what happened was the leftover follicle became a corpus luteum. So after ovulation and from that point, until through day 28 in the ovary, this is called the luteal phase, named after the corpus luteum. The first week-ish, the corpus luteum is getting bigger and bigger and bigger, making all that progesterone in anticipation of a pregnancy. It's looking for the HCG feedback from the zygote. If it doesn't get it, it goes on strike and starts degenerating. And that decrease in hormones is what's going to be actually triggering the period. So if we look at the ovary and compare it to those 4 hormones I've talked about, let's start here on the left. So I have the ovary repeated in both places, but I've separated out the hormones from the adenohypophysis versus the hormones coming from the follicles, the ovary on the right. So initially what we're going to have is in black, we're going to have an increase in follicle stimulating hormone causing the follicles to start developing. As the follicles start developing, we have increased numbers of follicular cells. What we are going to see is the estrogen levels are going to start going up. When the estrogen level hits whatever that magic number is for you or that woman, that will cause a peak in luteinizing hormone. that sudden peak in luteinizing hormone is what triggers ovulation. After ovulation, we've lost a lot of the follicular cells, so you can see that the estrogen levels are going to go down, but the follicular cells that are left behind start producing massive amounts of progesterone. So progesterone levels go from being really low to skyrocketing, but they also will be producing estrogen. So we're going to have high estrogen levels, but the big difference is this massive amount of progesterone happening. That will continue. Looking for HCG anywhere, no HCG, and look what happens to the progesterone level. It just goes woof, right down the slide. And that's going to cause the disintegration of the corpus luteum. So, follicular phase here, ovulation, luteal phase here. All right. So now let's look at the uterine phase. In the uterine phase, we really mean endometrium, okay? Because it has nothing to do with the muscle. So we're looking at that inner lining of the uterus. Starting at day 1, remember, we are sloughing, we are having the period. So the inner lining of the uterus is getting thinner and thinner and thinner. And we said that's going to happen until day 5. So days 1 through 5 are called the menstrual phase, and this is totally due to the loss of progesterone. So the loss of progesterone happened here, days 20 through 28. That's when this starts breaking down, but you don't start losing uterine tissue until day 1. So that period is not just blood, it's endometrial tissue and blood that's being sloughed. Now remember, what's happening in the ovary is we are starting to build follicular cells. So we have estrogen levels going up, and that's going to continue going up and up and up until ovulation at day 14. So days 5 through 14, we are building up the endometrial lining. Days 6 through 14. So this is called the proliferative phase of the endometrium, and it's totally due to estrogen effect. At this point, the endometrium can end up being about 1 millimeter in thickness. As you can see, blood vessels are growing in, and the epithelium is developing glands. After ovulation, we have a progesterone effect. This uterus is now in what we call the secretory phase. Due to progesterone, the blood vessels have become very, very tortuous. We have like little blood lakes, and when we look at the glands, they become very branched and they start having thick secretions, and the endometrium now can be 3 millimeters in thickness. So if an oocyte was ovulated and hit the endometrium at day 5, it would be like hitting a sheet lying on the floor, and it would just roll out through the cervix and the vagina. If it would hit the endometrium at the end of the proliferative phase, it would be like hitting a sleeping bag. There's a little bit of padding, but it's not enough for it to embed itself. So it also would roll out. But when it hits here, during the secretory phase, it can embed itself. And that's what needs to happen for a pregnancy to occur. So this slide has everything on one picture. So you have the endometrial phases here at the bottom. Remember, there are 3, the menstrual phase, the proliferative phase, and the secretory phase. We have the 4 hormones in 4 different colors here to help you. Up here, we have the ovarian phases where we have the follicular phase, ovulation, and then the luteal phase. And then because the only way we used to be able to tell if somebody ovulated was doing basal body temperatures, this shows that actually after ovulation, your basal body temperature does go up, which is your body temperature as soon as you wake up. But notice it doesn't go up until a day or two after ovulation. So if you're relying on that, by the time it goes up, you know, that oocyte may be dead by then. All right, so thank you so much for all your hard work, and come on back for the next video where we are going to talk about the female hormones and what happens with them. So feeds into this. So the two go together very well. Hope to see you shortly.